Hello friends, welcome to Medicine 101. Today we'll talk about vasculitis. So from the cardiology sections we did upload some videos and it was left, so that's why I thought to upload a videos regarding the vasculitis. So from the term it's very quite to understand, it's easy to understand. The vasculitis defines that inflammations of the blood vessels. So let me write it over here once. Inflammation of blood vessels. Okay. Now, for example, this thing can be, seen in terms of the non-infectious in most of the cases, okay, or you can say in most of the cases also the etiology immunological, you can say immunological, okay. For example, if we see it's a blood vessel, and if we see the inflammations over here, or as a result we will see maybe for the deposition of the thrombus over here, or maybe for some fibrous tissues is getting deposited. As a result, we will see the lumen. Whatever the lumen we are seeing over here, this lumen will be definitely narrowing. So the narrow lumen will be over here. And for example, just assume there is an organ. Okay, there is an organ that should be supplied. Okay. Now, if the lumen is less, so what will happen? That definitely the blood flow within these regions will be less. So the less blood supply will be within the organ. As a result, we will see there will be development of the ischemia. Okay. So if you see the inflammations of the blood vessels, you can see this type of things over here. The blood flow that will be very less within this individual of the organ aspects. So that will lead to ultimately the ischemia. Okay. Now that there are many types of the blood vessels in terms of their size and shape, we can say. So on the basis of the Chapel Hill, so let me write it over here. Chapel Hill classifications, we can define the vasculitis and the three levels. For the first one, we can talk about in terms of the large blood vessels. For the second one, we can talk about in terms of the medium sized blood vessel. Okay. And for the third one, we can say in terms of the small blood vessel. Now, if you talk in terms of the large blood vessels, define it. So, what from the aorta, there are various types of the branch that will be coming out from the aorta, the major branches. Okay. Now, if I want to show you once, just please do it me once. For example, is the aortic arch. We know is the brachiocephalic trunk. Okay. Anyway, just for understanding purpose, it's anatomical and not correct just now. Okay, now it's the brachiocephalic trunk. From here, we'll see the origination of the two types of the arteries. We'll get over here. One will get the right common carotid artery. We'll get another one is right subclavian artery. In the same way, it will be what? It will be the left common carotid artery, and it will get the left subclavian artery. Okay. And from these portions, the left common carotid artery, if we see further, it will be divided into the what? Left internal carotid artery. For example, I'm just taking the left internal, okay, carotid artery, left external carotid artery. Okay. So there will be various types of the branches that will separate to the blood vessels to different organs. Now in the same way, if we just see from the on top of the internal carotid artery, from here a branch will go to the temporal part. Okay, within this part, the lateral view from the frontal within this region is temporal, and that will supply the blood. We'll get the terminal, on top of the terminal branch. So that will get the superficial temporal artery. Superficial temporal artery over here. Now these arteries will be supplied by this one, the internal carotid artery. Okay. Now whatever the problem we see over here, for example, for any regions, if you see within these arteries, okay, if the blood supply is less, you see the blood supply less, so definitely there will be also problem. And what type of the clinical manifestations we can see over here, I'll talk about here. Okay. So first we got over here for the temporal artery. Okay, and whenever the inflammations of the temporal artery will be there, definitely it will form the temporal arteritis. Definitely no doubt about it. From the arteritis. So the temporal arteritis will be found there. Okay. Now we'll talk about first the temporal arteritis. Within the in a medium sized blood vessels will get the renal arteries, will get the popliteal arteries, and within the small blood vessels you know these things. Okay. Now while step by step, first I will cover the large blood vessels. If there any kind of the inflammations we find in terms of the large blood vessels, for example the temporal arteries over here, that will be the branch of the internal carotid artery. We will talk about these things. Okay. Now let me start from the first one, from the temporal arteritis. So with me. Okay, let me erase this part also. Now I'll talk about the temporal arteritis first. Now, if we see the temporal arteritis over there, now whatever the clinical manifestations you can see over first temporal arteritis things. As we know, the temporal artery is localized only in these regions, so that will be localized. Okay, so whatever the symptoms we will get over that will be localized within these portions. So we'll see that headache, and that is localized, not general. Okay. Okay. After that we will see the jaw claudication. Why we will see the jaw claudications? Because we know that some muscles for the mastications, if we see in these regions the muscles of mastications, if they are not supplied enough, okay, if the blood in these regions goes less, as a result these muscles will be not able to work properly. Okay, they will not be able to perform their activities. As a result we will see the jaw claudications. This is the problem. Okay, and we can get also, so if we just talk about in terms of these two symptoms, so the headache, that will be most common symptoms. Okay, it's the most common symptoms. It will be most common symptoms. And the jaw claudications, this one will be the most specific one. Try to understand, don't get confused. If I talk in terms of the headache, that will be the most common one. Okay, it's the general one. And if you see the most specific one, that will be jaw claudications. This type of the problem we will see over there. Okay, then we'll also get the, it's normal for the fever, we'll get malaise. Okay, along with that, the most important one we will get over here, that is polymyalgia rheumatica. Polymyalgia rheumatica. Okay. So whatever the problem we'll see in this case is polymyalgia rheumatica. Okay. Rheumatica. And so in these cases we will see that the patients will feel the muscular pain and the joint pain. The muscle pain we'll see over here, and we'll see the joint pain along with this. So this is one kind of the arthritis where we can see the polymyalgia rheumatica. Okay, try to understand. The polymyalgia rheumatica you can see in case of the temporal arthritis. Okay. And in these cases, whatever the thing we'll see, there will be pain, basically muscular pain and joint pain, that will be found most specifically within the shoulder girdle. Yeah, okay. These portions. And you can also notice in terms of the pelvic girdles. So you can see the shoulder girdle as well as within the pelvic girdles in these hip regions. Okay. Now, where can we see? Okay, in case it is most found. So if we see in terms of the individuals, it is most common in case of the young adults, and it also be found in case of the female. In case of female, more than 50 years. So the female, those who are more than 50 years old, there is a chances for them to develop the temporal arteritis. Okay, how can we just do the diagnosis for them? So now we'll talk about the diagnosis. So if you talk about in terms of the diagnosis, it's very easy to understand that whenever the inflammations will be over here, definitely the total leukocyte count That will be more. Along with that, we have seen also before that if whenever the chronic inflammation or the inflammation process is keep on going, as a result we will see that there will be also the erythrocyte sedimentation rate that will be also increased. In these cases, we can say that the value will be more than at least the 55 mm in the first 1 hour. Okay, sedimentation will be this much. Okay, now how can we just do the investigations, the diagnosis? Now the investigations, we can say in terms of the investigations of the choice, if we say in terms of this, the best one we can do the biopsy. What can you do over here? We can do the biopsy. Now for example, if we say that this is the temporal artery, for example. Okay, now the inflammations over here, that will be in the patchy fashion. Okay, just like this, in the patchy fashion. Now for examples, within the biopsy we just take the tissues part. For example, we are taking the sample from these regions. So if we just do, there will be no histopathological findings. Now if we talk about histopathological findings, we cannot see any types of the histopathological findings because these portions will be not affected here. There is no affections over here. Now if we see this part, this part is already affected, pathogenesis over here. Now if we see from here, then you can get the positive for the histopathological changes findings. Now if you take from here, so you cannot do it like this. So as a result, we are supposed to do 1 centimeters of the tissue should be taken just to check whatever the histopathological changes are there or not. So okay, it should be at least 1 centimeter over here. If it is less than 1 centimeter, we cannot take, because if we take less than 1 centimeter, maybe this part will be not there. Okay, but if we take 1 centimeter, is large enough. Okay, so we can just do the histopathological findings. We can check over there. Now whatever the changes are found in these cases, that we need to know. As we know, that is the chronic inflammations, and we know within the chronic inflammations, okay, we will see about granuloma formations, giant cell, okay. So whatever thing we see over here, that is the giant cell, or we can say that granuloma formation. That's why, as we see the giant cell over here, that's why another name for the disease that is known as the temporal. Okay, let me write it over here. Giant cell arteritis. So another name for it, giant cell arteritis. Now whatever the another problem we will see, I already said you that internal carotid artery will supply here. Along with that, we know that internal carotid artery, there is also a branch for it that will go where? Within the eye, and that will give you a branch that is known as the ophthalmic artery. That will give the ophthalmic artery. Now if we see any type of the inflammations over here, or if we see the less amount of the blood is going with these regions, then we can see whatever the problem, that there we will see the sudden onset of the blindness. Sudden onset blindness. Okay, this type of the problem we can see over there. So already said, we will see within histopathological findings the giant cell arteritis, we will see the granuloma formations over here. Then we can see the ophthalmic arteries will be less that will be deficiency of the blood. There will be deficiency of the blood. As a result, we can see certain onset of the blindness. That was the thing we can also see over there. Okay. Now, how can we just do the treatment for these things? That's the main thing over here. Okay. Now, if we say that in terms of the treatment, let me write it over here. Yes. If we say in terms of the treatment, whatever the treatment you can give over here, the first thing that should be steroid. There's the drug of choice in these cases. Okay. And if we see steroid is not available, for example, a patient's individual who is from the village, near him there is no hospitals or no nursing home, as a result, what can we say? Suggest the patients, okay, we can use the plastic bag. The plastic bag, we should just give the patients over the face, and we'll say the patients or ask the patients to exhale and inhale. Exhale and inhale. And whenever the patients will exhale and inhale, as a result, we know normally that carbon amount of the carbon dioxide will be more over here. So the more amount of the carbon dioxide during the exhalation and inhalations will go in the circulation, and after going there, that will cause the vasodilation. And whenever we see the vasodilation, there will be still some chances for the patients to go up. There will be some time for the patients to go at least to the hospitals or to the nursing home for the better treatment. Okay. So this type of the thing we can see over there. Okay. Now, if we just see in terms of these things, then we'll get another one, the Takayasu arteritis. Now we'll get over here another type of the arteritis on the basis of the blood vessels, that is Takayasu arteritis. Okay, I'm just writing it over here. Takayasu arteritis. I'll talk about the Takayasu arteritis in the subsequent part. Basically, if we see that within the Takayasu arteritis, Takayasu arteritis. Okay, in these cases, we'll see there will be the different. The problem will be over the aortic arch. So definitely we'll see the problem over the aortic arch. So another name for the this type of the problem, that is known as the aortic arch arteritis. So this type of the problem you can see over there. Okay, so this was all about the diagnosis, the histopathological changes, the investigation of choice, and the drug of choice over here. Okay, so this was all about the temporal arteritis. In the subsequent part, we'll talk about the other types of the arteritis, Takayasu arteritis, and we'll talk about the medium types of the blood vessels, what are the changes we'll see, and there the different kind of the diagnosis treatment as well, the small artery as well in the subsequent parts. So if you're new, please subscribe my channel, and don't forget to put like if you think that this video is helpful for you, and don't forget to share to your friends as if they can also get the benefit from me. So thank you for watching, and please subscribe.